This week's Ask Dr. Durie question comes from a patient who wants to know what is the role of treatment with high-dose melphalan combined with autologous stem cell transplant or rescue in 2017. This is a therapy that has been available for many years, but is it still equally important in 2017 when we have many new therapies available? And so the answer to this question is a definite yes. We still value the impact of autologous stem cell transplant. The role of high-dose melphalan and transplant has been evident over the last 30 years. In many, many studies, the value has been demonstrated, and almost always patients who have been transplanted have had equal to or better outcomes versus non-transplant patients. And one particularly important aspect has been in an IMWG analysis recently. We looked at what was the outcome for patients who were in complete remission after 1 year having received an autologous stem cell transplant, an ASCT. And the answer to that question in a large data analysis turned out to be that at 20 years, 14.3% of these patients were still in remission. And so this is what can be described as a potential cure fraction when you compare what would be the likely outcome for an equally matched by age and sex population of people without myeloma. And so even with current therapies combined with autologous stem cell transplant, there really is a long-term impact and benefit. But the question has emerged just recently with the publication of a large study from the IFM team in France where they looked at VRD, a triple therapy, combined with frontline transplant or not. And the question has been, with this VRD therapy, is transplant still important? The results were just published in the New England Journal of Medicine, and clearly the remissions were definitely better with the transplant. However, at this time, with an approximate 4-year follow-up, there is no obvious survival benefit with the transplant in this setting. And so this is partly what has opened up this question. And the real issue is, how do we evaluate longer-term benefit in the short term? And this is where the use of MRD testing comes into play. And patients who are MRD negative, we know, have a better longer-term survival benefit. And so in this IFM study, more patients, approximately 10-15% more patients became MRD negative after the transplant versus the chemo alone. And so although we have not seen this yet, there is a strong implication that these transplanted patients will ultimately do significantly better. And so the bottom line here is that we still value high-dose melphalan with transplant, and we still feel that it is an important part of our armamentarium, one of the treatment options that we should strongly consider. And we will continue to look at the role of transplant combined with our novel therapies and in use earlier in the disease to achieve the best results possible.